PubMed Workshop, Finding the Evidence. This is an introduction to literature searching in the PubMed database. This video will cover the following topics: converting your research question into search terms, mapping your search terms to the medical subject headings in PubMed, and using the appropriate filters in PubMed to refine your search results. Before we jump into PubMed, I want to first set the stage for searching and talk about some things to keep in mind when you're actually conducting your literature search. We get this question a lot. When is it okay to use Google, or why can't I just use Google? And Google can be useful when you're looking for general or background information. In terms of medicine, it's especially useful for new topics that might not yet be covered in clinical summary tools like UpToDate. So an example being COVID. When COVID-19 first appeared, you would not have found much of anything at all in the academic literature. And so Google can also be useful for trying to find or identify synonyms for your search terms, especially if your topic is interdisciplinary. Google's also useful to search for government information or data, such as that from the CDC or other state or local organizations, government websites. And in general, though, if you're looking for foreground information, the kind of information you need to answer research questions, you may want to use Google Scholar over Google. And so another thing to keep in mind, in general, any information you find, you should approach with a critical thinking lens, especially if you're Googling. But even when reading through academic literature, you still want to approach it with some sense of caution, question what it is that you're reading. We personally here like trustortrashit.org. It's a tool that poses a set of questions around who said it, when they said it, and then how do they know? How do we know that they know what they're talking about? So if we've learned anything during the pandemic, we must choose our information wisely. And so this is another way to and something else we want you to keep in mind. In medicine, in addition to thinking critically about who wrote it, who wrote what, we also have a pyramid of evidence to help guide our thinking. So as you're conducting your literature reviews or your literature searching, you may end up with hundreds of search results. And it can be daunting to try and figure out what to read first. So how do you know which articles to read, or which articles to actually use as your evidence in your own reviews? So what you want to do is kind of consider the quality of the evidence. So at the top of the pyramid here, we have our clinical practice guidelines, meta-analyses, systematic reviews. So these are pre-appraised articles and sources. So the clinical practice guidelines, you can think of that as there's a group of clinicians and they've come to the conclusion on what treatments should or should not be used. They essentially are presenting you with an answer. At the base of the pyramid here are animal and laboratory studies. These are primary studies, and they're the bits and pieces that go into these secondary studies. So the meta-analyses, systematic reviews. This is what they're comprised of. So the primary studies from the base of the pyramid are what go into these systematic reviews, and then the systematic reviews, meta-analyses, are what are used to actually put together clinical practice guidelines. So when you are staring at a page full of search results and you're trying to decide, should I read this case report, or should I take a look at this RCT? Read the RCT. And the systematic reviews can often be pretty helpful just as a starting point to get a nice broad overview of your topics as well. Creating a searchable question. When you're going to be doing a literature review is because you have some sort of research question you're trying to answer. So this is an example I'm going to use throughout the presentation. My example question is, what is the effect of mucolytic agents on patients with COPD who are stable? So to start off, we don't want to type our entire question into PubMed. In general, PubMed doesn't handle entire questions well. It's going to try to map all of these different terms we just put in. It's going to try to map those to an article. It's also not going to understand certain terms, so terms that are trying to express a time sequence or a cause and effect. You want to try to limit your search to nouns. So this is why using a mnemonic like PICO is going to be helpful. So we want to search PubMed with a few concise concepts that represent our topic. So PICO is a mnemonic used in medicine to help formulate a search. It's a way of breaking down the clinical question into its most important, most searchable parts. So this is the idea is to help you create a more focused search. So note there are other research question mnemonics that you can use. So here is one where this is our literature review basics and searching skills guide. So you can learn about all the different types of literature reviews. But what I want to point out here are these different mnemonics we have for creating research questions or breaking your research questions into searchable parts. So this page specifically talks about PICO. It talks about PCC, which stands for Population, Concept, and Context. So this is useful if you have a bigger, broader topic. Whereas PICO is good if you have a clinical question. So there's also population, exposure, and outcomes. SPIDER, which stands for sample, phenomena of interest, design, evaluation, research type. And then this COSMIN. So depending on the type of literature review you are trying to do, one of these might be better. So SPIDER would be good for the qualitative mixed methods research. PCC is good when you've got a broad topic. PICO is, of course, it's meant for clinical questions. Okay, so this is our research question broken into its PICO format. So the P, our population here, are patients with stable chronic bronchitis. The intervention, the I, those are mucolytic agents. The C is a comparison. So in our clinical questions, we don't always have a comparison, or it may not even be stated. So with this particular question, we don't state the comparison, but if you think about this question, so the intervention being a drug, a comparison would be a placebo. And then the outcome, again, this isn't always stated, but it's kind of implied. Like what's the goal of treating a person with chronic bronchitis with mucolytic agents? So you're trying to reduce the number of exacerbations and, of course, mortality. So then what this looks like in search terms could be something like this. So COPD or chronic bronchitis would be one part to search. We might also search mucolytic or placebo, and then exacerbation or mortality. And so the other thing you want to keep in mind is it sounds obvious, but you have to know what you're looking for, what it is, what kinds of articles are going to answer your specific question. So what kind of studies are you looking for? With this particular example, it's a clinical question dealing with an actual drug. So we're talking about therapy, we're talking about treating COPD. So that translates to a clinical trial or an RCT. If this question was more concerned with the cause or the etiology of COPD, then we might be looking for a cohort study instead. And then there may be other inclusion or exclusion criteria to keep in mind. Is there an age group that you're interested in? Does it need to be within a certain date range? So all of these are are filters that could be applied within PubMed. So it's especially important to keep these things in mind. Keeping this in mind is going to help you weed out all of the irrelevant search results.
So for this next part, we are going to be taking a look in actual PubMed. I have a couple handouts here, or a couple guides. So I have a link to our PubMed how-to guide. This is through the Japsam Library website. And then there's also a link here to a Google Doc that has some, here, I'll open this up. It's a Google Doc with some reminders of different ways you can search. So your ability to search by different fields, how you might use the ands, the ors, or a not. So just some good reminders here, along with some description of what these different ways of searching will do to your search. And then here, this link to our PubMed guide. So you can use this as a reference if you're trying to figure out different ways of searching, if you're trying to troubleshoot a search. So there's some explanation here about, when you have too many results or not enough results. So there are over 32 million citations in PubMed, and it's growing every day. PubMed is a free search interface, which means anyone can search it to find the citation information they need. And note that I said citation information. So PubMed itself doesn't contain the full text to articles unless it is PMC, the PubMed Central. So PubMed only searches the titles, the abstracts, author info. It does not search the full text to the articles. So that's why the keywords you choose are really important. So you can think of PubMed similar to OneSearch if you've already watched our video on how to use the library in general. So similar to OneSearch in that there are multiple streams or silos of information coming into PubMed. So if you look at the diagram on the right here, PubMed is the blue box, and the information it contains is arranged in these two containers, and some of it is overlapping. So the first container, the circle on the left, called PubMed Central, and then there's also the bigger container, the circle on the right, that's called Medline. So the distinction between the two is important because PubMed Central, or PMC, is the open access content. So research that has been funded through taxpayer dollars, think NIH or NSF grants, those works are required to be available and accessible to the public. It also contains publications ahead of print. It could be, it's considered non-indexed information, which means it's not organized. So Medline, on the other hand, is the subset of PubMed that is managed by the National Library of Medicine, and it makes up about 90% of what is actually contained in PubMed. So there are subject matter experts who read the articles going into Medline, and they assign these additional keywords. So this is known as MESH, medical subject headings. They assign these terms to the articles, and what that means is that Medline becomes highly organized, and you're able to find the keywords are used to link all of these similar articles together, so kind of like a hashtag. So what that means is that PubMed the organized part of PubMed, Medline, compared to PMC, which doesn't have a set of keywords assigned to the articles, means that there's no standardization to the terminology in PMC, where there is some standardization in Medline. So this distinction is important only because, just keeping in mind that using a MESH term, the medical subject headings, can make your searching go a little bit easier, and it's a way of helping you, kind of hone into what it is you're looking for more precisely. So to start searching, we recommend starting from the library's homepage, especially if you aren't using LibKey, which there is a video here if you are interested in it and you haven't installed it yet. So you'll be asked to sign in and authenticate with your UH-Manoa username, and this will help prevent you from hitting paywalls when you're looking for the full text. So this is our homepage, and the PubMed link is listed under quick links on the left-hand side of our page. And I'm going to keep up with our same example here. So what is the effect of mucolytic agents on patients with COPD who are stable? Okay, and then here are our search terms we're going to start with. In the example I showed earlier, I had COPD or chronic bronchitis, I had mucolytic or placebo, and I had exacerbation or mortality. But to start with, I want to keep things a little bit more simple because I'm still trying to get an idea of the scope of what's even available in PubMed to begin with. So this is my search, COPD, mucolytic, exacerbation, and I have 228 results. So note I have COPD, mucolytic, exacerbation, and I don't have any ands in between these terms here. But what PubMed does automatically is it assumes that there's an and in between each of these terms. So it does actually search at something like this. So PubMed will assume there's an and between my search terms unless I say otherwise. So unless I type an or a not. So best practice for your first search is to keep it simple, be specific, avoid any kind of quotation marks or truncation. There are exceptions, of course, but I think it's good practice at first to just let PubMed do some of the work. By using quotation marks or any kind of truncation, it stops PubMed from its ability to map you to its mesh terms. So I'm going to actually go to a live screen. Let's just go to PubMed. So I'm going to start from my library's homepage. I'm going to click on PubMed, and I'm being asked to log in. So this is how we know PubMed is being linked to library holdings. It's because I'm being asked to log in. With PubMed, because it's free, it's a free search engine, it's available to anyone. So there's this public version of it that anyone can search. And so if you enter PubMed through Google, it doesn't know that you're affiliated with their university, so it doesn't know what you have access to. But if you enter PubMed through the library's homepage first, you're forced to sign in, and then PubMed will know what you have access to. So that's kind of key here if you're not using LibKey. Okay, so PubMed, and I'm searching for COPD, mucolytics, and exacerbation. There we go. Okay, and it's the same as this. It's the same as and. Okay, so same. So next, what I want to do, I want to see how PubMed is translating the search. I'm going to click on Advanced. It's right underneath my search bar. And so what I'm going to do now is I'm going to, this is my search history and my search details. I can also run some advanced searches in these boxes up above, but for today we're going to concentrate on what's here in search details. So I'm going to click on the arrow that is this arrow that is going to show me what PubMed did with my search. So what I want to see is that I want to see these translations here. This COPD term, it maps to the mesh term pulmonary disease, chronic obstructive. Mucolytic maps to expectorants. Exacerbation, so this term might be, PubMed is searching the alternate ways of spelling exacerbation, or it's exacerbations, exacerbating, the different ways of saying exacerbation. But it isn't mapping me to a mesh term. So it could be that there's a better term. That's just one thing to keep in mind with this search. It could mean that maybe I want to expand on exacerbation a little bit, since it seems like there might be multiple ways of kind of capturing that concept. So there are screenshots in this PowerPoint for everything that we're covering. So a little bit more about the medical subject headings. So MESH, or the medical subject headings, what you saw here, it works kind of like a hashtag. So the reason we want to map to this is because, so this is the part of PubMed that is Medline. So it's the part that the National Library of Medicine takes care of. It's the part where an indexer is assigning these terms to it. And what that means is that if an article, there's lots of different ways of referring to COPD or to heart attacks or to cancer, but by assigning an agreed upon term, it brings all of those articles that may have referred to a disease in a different way, it brings them all together. So it just means that you don't have to think of all the different ways of referring to COPD. It pulls all of that information together for you. So MESH is a really, really powerful tool with PubMed. It's one of the things that sets PubMed apart from other databases. It's also one of the reasons why PubMed is our go-to in terms of searching for medical information, because we have this set of agreed upon terms. So what would happen, let's see, what happens if you don't see your search term mapped to MESH? So this is an indication that it's time to think of new search terms. And so this is just another example. If I searched here, my original search is gut health, but I can see where it's mapping. It's mapping me to a journal called Gut. And then it's searching, it's searching gut, it's searching health separately, but it doesn't really get the concept I'm looking for. So I need to think of a different way of searching for gut health. So stomach bacteria or gut flora or gastrointestinal microbiome. You just have to start kind of getting your mind to think about your question a little bit differently. Okay, so if we were going to expand on this search here, I might decide to, maybe I'm going to do COPD and mucolytic or placebo and exacerbation or mortality. So I think the main point is to try to probably expand on that exacerbation part of the search. So this is what my new search looks like now. And I'll go to a live window. I am going to just click on the number under results to rerun this. And now I'm going to add exacerbation or mortality. So COPD and mucolytic and exacerbation or mortality. So now I have 248 results. So I have I think it was 228 before that. If I wanted to keep trying to add on, I could say mucolytic or placebo, or maybe it would be better to even start, I could add on the actual pharmacological names of different mucolytics. So that added a ton of more results. So about 1,000 more results now by adding on placebo. So that made a big difference. Let's see. So this is just a little bit more of an explanation here of our using the Booleans, the ands, the ors, the parentheses. So this COPD and mucolytic and parentheses mortality or exacerbation. The database is reading this as two separate statements. So by having our parentheses around mortality or exacerbation, PubMed reads this as it's looking for articles that have COPD and mucolytic and mortality, or it's looking for articles that have COPD and mucolytic and exacerbation. So those parentheses are really important because it tells PubMed how to read the statement. If I took off my parentheses here, so in this example, COPD, mucolytic mortality, or exacerbation, I have 105,000 results. So, the original search was about 200 results, and if I with my actual parentheses around mortality or exacerbation, it should be somewhere more around. it should be somewhere closer to, let's see, we'll use the exact same example that was in my slide. What was it? It was 248. So whenever you see those big, huge numbers in your search results, especially if it's in the millions, that means there's something wrong with the spelling or syntax. That's a good clue that there's just something wrong with how you typed in your search terms. Here, I'm going to add mucolytic or placebo back on. And then remember, if your search is ever doing something funny and you're kind of just like, the titles of these don't make sense, they don't look relevant, remember to check this advanced. Click on advanced and then check your search details to see what it's doing, there's got to be something funny going on. So a little bit more on the building blocks. So in general, and is going to give us less results because we're putting more restrictions on the database. We're saying I need this and that. And or is going to give you more results because you're giving the database more options. You're saying I'll take either or of these concepts in an article. And the not is what you would use to eliminate certain results. So I like to use diabetes as an example. If you were running a search on diabetes, but you were only interested in, type 2 diabetes, you could say not gestational. That could be one instance where you use it. The parentheses, like I said, they're used to nest your synonyms. You have to have the parentheses around concepts that you're saying either or to. An asterisk is used to find alternate spellings. So if I wanted to search for, let's see, so we had all those different variations in exacerbation or exacerbating. I could do this and it would search, I could put an asterisk there and it would search for all of those different variations in spelling. So PubMed on its own does a pretty good job of that. And when we checked our search details, we saw that it was already, it was doing a good job of searching the alternate spellings here. I think other places it could become useful is if your topic is, if you're doing a search on Hawaii, but you would take an article that mentions Hawaii or is about Hawaiians, then that would be a good place to use an asterisk. Let's see, our quotations now. So in the beginning, I said to be careful about using these asterisks or using quotations because it does turn off mesh. But there are times when it may be useful. So one example would be, if your topic is bone setting. So this was a topic that there wasn't really a specific mesh term for it. And if you search bone setting without the quotations, it's going to search for bone and setting. It breaks the concept apart. But this being a really specific concept, in this case, we'd want to use quotations around it, and we can use it knowing that we aren't turning off any of the mapping that PubMed tries to do for you. So whatever you choose, this is just to say to be really deliberate and thoughtful about it. Okay. So once I've done my search and I think I'm pretty happy with the results, right? I'm in a sweet spot where it doesn't seem like it's too many or too few. I like to think of database searching or literature searching kind of like an accordion. If you think of how an accordion goes in and out, maybe I start with too few results and I take it out and I get too many results, but then I can bring it back in to a better place. So once I'm happy with the search, or another way you might know you've kind of exhausted your search is if you've tried different terms and you're still seeing pretty much the same results coming up, it's a good indication that you might, you may have exhausted it. You're probably in a pretty good spot with the search. So at that point, I would start turning on my filters. So this is where I might want to think about my inclusion and exclusion criteria again. What kind of study type is going to answer the question I have? What kind of articles do I need to read? So in PubMed, we've got our filters on the left-hand side of the page. So since this was My question's about mucolytic agents. I'm looking for randomized controlled trials. So I'm going to limit my search results to RCTs. I can check the box, and I'm down from 481 to, 1,250 results to 481. I could limit by years, but I'm looking for additional filters. Maybe I want to limit by age. So I'm going to click on additional filters here. And so I have many more article types that I can choose from. Let's see, what do we have? Comparative studies. There are different types of clinical trials. But what I'm looking for are age groups. So there's also species. I can limit to actual human studies. I can limit to language. I can limit to sex. And then this subject, this is just, this would just help you limit to these very specific topics. I can limit to journals. So if I know I'm only interested in nursing journals, dental journals, Medline would be core clinical journals. And then I can limit to age group. So maybe my the population I'm interested in is middle-aged. So here, I'll check this one. And I'll hit show. So now the middle-aged filter here, it's shown, but I still need to actually click on it to activate it. So 425 results. So it could still seem like it's too many results to go through. This is a lot of clinical trials, so this is where maybe for this certain question there is a specific mucolytic that I'm interested in, and that might help me to narrow this down further. I could also take off placebo just to see what that does to the search results. So 33 results. So a big difference what that placebo makes. So that would be something worth taking a look at, reading into a little bit further. So in general, I think you have to keep in mind that the actual search can only take you so far, and that you do have to do some actual reading sometimes. There's only so much that you can search for, and that some things need to be read in the context of the study in order to find the proper answers that you're looking for. Okay, so just making sure we covered all of this. Okay, so this is when you're ready to actually read one of these articles. Why don't I'll click on this first one. So let's say I'm ready to read this article. If you're using LibKey, then you can click on the LibKey icons that pop up here. If you're not using LibKey, then you'll want to use the Find It button. So this button is key for finding the University of Hawaii at Manoa, the UHM full text. These publisher buttons, sometimes they will still take you to a paywall, so it's best to just use the Find It button. Okay, and so this is a really good example of why you would want to use the Find It button. So for this particular article, it doesn't appear that we have the immediate access to full text. So I'm going to sign into this. This is our OneSearch tool. So if you have a University of Hawaii at Manoa login, you can sign into this and you can request a PDF scan. So this goes to our interlibrary loan department. I'm going to log in again. And we have an agreement with other universities across the country to share resources. So this is a service that we can use at no additional charge. So the form's already filled, and I just need to hit on Submit Request. I'm not going to submit it, but what I will do is try to go back to another one. So that Find It button, it takes me to the form that I need to submit an interlibrary loan. Let's find another one. Let's see. Let's click on this one. Let's see if we have it. Okay, we should be able to open it. Okay, so LibKey buttons, it says download PDF right away, but I'll go ahead. I'll click on the Find It button so you can see what it looks like. I have a couple more click-throughs to go through if I'm not using LibKey, but here I have a download PDF option, And fingers crossed. Here's my PDF. So Find It button's key if you're not using LibKey. So I hope this video was helpful. I hope that you have a better idea of how to convert your research questions into search terms for PubMed. I hope that you remember to check that your search terms are mapping to the medical subject headings. And then I hope that you remember to use those filters. Those filters are key to help you get rid of irrelevant results. And then also just, remember that if you're not using our LibKey tool, that you need to access PubMed from the library's homepage first. So you'll sign in, you'll be authenticated, and then you'll be able to get around those paywalls and use the Find It button. So, and then of course, reach out if you have any questions, if you want more help. We've got additional videos on PubMed, so how to search by a specific author, and then also how to search PubMed when you're looking for a specific journal. So those videos are here as well. Have a great day. Thanks.